My name's Alex. My pronouns are she, her. I'm living in Maine, but I am currently in West Palm Beach. I'm an organizer with National Nurses United on our national campaign to win Medicare for all. And like Angie said, National Nurses United is the country's largest union and professional association of registered nurses. And I'm really excited to talk with you about our plans for 2024, which are already kind of off and running, but only a little bit. They've only just left the starting line. So excited to share with you more about how you can work with us this year. So this presentation should take me about 20 minutes, depends on how many questions you have, but I'll make sure to wrap it up with enough time to do those questions. All right, so to cover briefly what's going to be on the agenda for my little presentation here, I'm going to start with sharing a little bit about who we are at National Nurses United and why we've been working so hard to win Medicare for all for decades. Then I'll share a little bit about our campaign goals for 2024 and how you can get involved in them. And at the end, of course, we're going to have time for questions. There we go. Sorry. Why are my slides not working? Here we go. There we go. All right, so who are we? Who is National Nurses United? So National Nurses United is the largest professional association and union for registered nurses in the country. We represent nearly 225,000 bedside nurses. We have members in all 50 states with affiliates in California, Minnesota, Michigan, and DC. And we pride ourselves on being really like a militant union that organizes with our direct experience as caregivers. And when I say our direct experience, I mean the nurses. I myself am not a nurse, but our direct experience as caregivers in this broken and corporate dominated healthcare system. So at NNU, we believe that all people should be able to get the care that they need when they need it without worrying about cost. And our nurses have been really fighting for Medicare for all for decades because they see firsthand the effects of the broken healthcare system. They see their patients getting sicker or sometimes dying because they cannot afford to get the care that they need, and it breaks their hearts, and they are sick of it, and they know that we can do better, and they know that if we had a different system, they would be able to provide the care that they got into nursing to do in a much more effective and compassionate way. So they've been leading this fight for decades. Like I said, we have a really robust volunteer-driven campaign. One thing I want to say is that you do not need to be a nurse to participate in our campaign. We have people working with us on our campaigns from all walks of life. It's just the nurses that are kind of, paying my salary and the other people on my team to help facilitate this campaign around the country. But you do not need to be a nurse to be a part. I keep forgetting to advance my slides here. I'm sorry. You do not need to be a part do not need to be a nurse to be a part of the campaign. So that is a little bit about who we are. Now, every year we kind of have new and exciting plans that we want to, that we like to roll out to try to keep advancing this fight to win Medicare for all. Our theory of change is that the corporate healthcare industry is very powerful. It is very wealthy. It has bought most of our politicians, and it's pretty firmly entrenched, right? And the only way that we are going to have a chance of standing up to such a powerful system is through, not to overuse an overused term, but through people power. We know we have the people, right? We know that the majority of people think our healthcare system is broken, believe that Medicare for all is the solution. We just need to organize those people to come together and stand up to this powerful industry. And when we do that, we know that we can win because we do have more people and we have the numbers on our side. So our goal of our campaign is always just to to really bring more people into the movement, take them from passive support of the idea of healthcare reform into action. So in 2024, we have two main programs that we would love your participation in. So the first campaign is the Patients Over Profits campaign, which I'm going to talk more about in a second. And the second campaign is a nationwide canvassing program to identify what we're calling healthcare voters. This is people who, when they vote, their number one issue that they vote on is, is that politician going to do something about this broken healthcare system? So we're going to identify those people. And then really try to highlight the disconnect that exists. And I think Angie mentioned this at the beginning of the meeting tonight, the disconnect that exists between our Democratic elected officials, Democrats, and their constituents, the people who vote Democrat. 88%, some surveys say, as high as 88% of Democrats support Medicare for all, and yet only half of Democrats in Congress support Medicare for all. We want to highlight that issue in this election year, this very important election year, when it comes to the issue of Medicare for all. So that's the goal of our nationwide canvassing program this year. And I'm going to talk a little bit more about that in just a second. But first, I want to talk about the Patients Over Profits Pledge. So some of you may have heard of this before. I know that it's been mentioned on previous monthly meetings here with your group, or maybe you come to our calls as well. But just in case anybody is newer to the concept of the pledge, so the Patients Over Profits campaign has taken inspiration from previous pledges, such as the No Fossil Fuel Money pledge, that ask politicians to pledge that they will not take campaign donations from specific industries. So the No Fossil Fuel Money pledge asks politicians to not take money from the fossil fuel industry. And if you're not familiar with that pledge, they've had, I think, 4,000 politicians have signed that pledge, including every single Democrat that ran for the presidential nomination in 2024, including Joe Biden. We don't think there's any reason why we can't have the POP pledge get to the same level of prominence especially within the Democratic Party. So the POP pledge, which took inspiration from the No Fossil Fuel pledge, and sorry, I call it the POP pledge for short, but it is the Patients Over Profits pledge. It asks elected officials and candidates at all levels of government to commit to not taking campaign donations over $200 from the corporate healthcare industry. And that includes pharmaceutical companies, insurance companies, and for-profit hospitals. So you're seeing the actual language of the pledge here on the slide. Now, one thing I will note is that this pledge, it does not apply to like rank and file workers of companies under these industries. It's just like from the companies themselves, or anyone who's like a CEO or a member, an executive in the organization. And we created this pledge alongside a broad coalition of other organizations who work on the issue of healthcare justice, because we know that in order to win any sort of real healthcare reform, we first need to take on the direct relationship between healthcare corporations and our elected officials and their campaigns. Like I said, unfortunately, no real reform is really going to be won until we get our elected officials who are supposed to be representing us out of the pocket of these industries, who are basically paying them to stand in the way of any sort of reform that would benefit patients. So that is the idea behind the pledge. Now, we've been focusing a lot of our efforts for the last couple of years on this pledge, because, let's be honest, right now, there's not a clear legislative path forward. Democrats do not control the House. Even if they did, the Senate nothing's getting through the Senate. Joe Biden does not support Medicare for all, right? That is the reality that we are working under right now. So we have to kind of lay the groundwork for better conditions when the legislative path forward is more apparent. And that's what the Patients Over Profits Pledge aims to do. And over the last couple of years, we've had just over 150 signers on the pledge, and this is from all levels of government, which is really, really great. A lot of those are from here in Florida. I know Stefan's going to talk about that in a little bit, but all of this was made possible through our volunteer base, who researched for politicians' contact information, who attended in-person events, and reached out digitally to ask politicians to sign the pledge. And 150 signers it's a really great start. But in this year's election cycle, we really want to explode the growth of this campaign, and get as many elected officials and candidates to sign the pledge as possible. Like I said, we don't think there's any reason this can't get to the same level as the No Fossil Fuel Money Pledge. Our broken healthcare system is a rolling crisis. It is one that has become such a background of our lives. It's one that people tend to sometimes not want to think about, right? Like, we don't want to think about being sick. We don't want to think about getting injured. And then when we do, we are thrust into this broken system. And at that point, we're sick, we're injured, our family member is sick or injured, and we can't do anything about it, right? So this crisis is something that every single person is going to have to deal with at some point or another. And so, we think that this is definitely the time to make sure that we are really bringing the idea of our broken healthcare system and the fact that we need our politicians to stand up to it front and center. So this is the time, and we hope that you will join in on it with us. So this is where you come in, right? So I am here to talk to you about how you can get involved in helping us get more politicians to sign the Patients Over Profits Pledge. So like I said, 150 people is a great start, but if we really want to get the attention of like the higher profile politicians, the people running for president or for Senate, we need to get that number up there. We need to get thousands of signatures, right? Or signers on the pledge. We need to build the reputation and the legitimacy and like the name recognition of the pledge. So, oops. All right, so we have partnered with Medicare for All Florida to adopt the Patients Over Profits Pledge as a core part of their work this year. So thank you. And the reason why we're trying to partner with local organizations like Medicare for All Florida is that on the state and local level, your local politicians best. You have the best access to them. And we really believe that we can achieve that goal of exploding the growth of the pledge in your area if we have your help. So thank you for agreeing to work with us on this. And when you work with us, we provide you with everything that you need to identify candidates in your area. If you need help with identifying like who would be good to ask to take the pledge, we have all sorts of resources we can give you. We have written guides that have everything all in one place. We have template emails, template social media messages, template phone scripts, everything that you need to reach out to candidates and elected officials and ask them to take the pledge. And then also we're hosting monthly, we're calling them action calls, to give you a chance to connect with us, connect with other people who are working on getting signers on the pledge, and to kind of like trade advice on what's working best, and of course to answer questions. And then also on those action calls, we are going to be taking time to actually take action together, right there on the Zoom call, reaching out to elected officials and asking them to sign the pledge. And the first one of those action calls is coming up a week from tonight on Wednesday, March 27th. So I'll share the sign up link for that after I finish showing these slides. But I really hope that everyone here would consider joining that call next week. That would be a great next step if you're interested in working to get more signers on the pledge with us. So I think that's pretty much it for the Patients Over Profits Pledge. Although I know Stefan's going to talk, like I said, a little bit later, a little more about what's been happening locally and how you can get involved on the ground locally. So let me move on now for my last few minutes to talking about our nationwide canvassing program. So kind of the theory behind this program is that Medicare for All and healthcare reform was really a huge issue in the 2020 election cycle, right? We were in a global pandemic. So especially in the Democratic primary, people were talking about healthcare reform a lot. Now, of course, it's a different year. There's a lot going on, a lot of important critical issues that need to be discussed. And it's our job to make sure that this rolling crisis of healthcare, our broken healthcare system, doesn't get ignored, that it stays front and center in the conversation throughout the 2024 election cycle. And like I said, we also want to really highlight that disconnect between our Democratic elected officials and their constituents. Medicare for All attracts majority support across the political spectrum. 88% of Democrats, 46% of Republicans, 46% of Republicans, 68% of independents, and 69% of Americans overall. However, in the 2020 Democratic primary elections, exit polls showed, as well, in the Democratic 2020 primary exit polls, overwhelmingly, a majority of voters were supporting Medicare for All. But like I said earlier, only about half of Democrats in Congress support Medicare for All legislation, even less in the Senate. And why? Because they're in the pockets of the industry. So that's why we're doing the Patients Over Profits Pledge. But also, we need to demonstrate, we need to highlight and showcase that wide support exists for Medicare for All. And we believe that if we do that, we can give politicians the cover that they need to finally support Medicare for All. Sometimes a lot of these, especially these Democrats, right, they're just scared. They need to know that if they come out and they take the bold step of signing on to Medicare for All legislation, that they are still going to get reelected. So if they can see that a broad majority of their constituents, their voters, want them to support this, then in a lot of cases, they will stop being wusses about it, and they will sign on. So and of course, another goal of this program is something that we always want to be doing, right? Which is to continue to educate and deepen awareness about Medicare for All. We know that if we want to beat one of the most moneyed industries out there, this is what I was saying earlier, we really need a mass movement of people from all walks of life, and we build that movement one conversation at a time. So we plan to organize and support canvases around the country to talk to people about Medicare for All, to talk to our neighbors about Medicare for All. At these canvases, you would do two things. Number one, you would help conduct an informal poll to gauge people's support of Medicare for All and talk about their experiences with our broken healthcare system. And you would also help to identify healthcare voters who plan to prioritize the issue of Medicare for All in how they vote in 2024. And after months of canvassing and hopefully thousands of conversations all around the country, we're going to take that data from the informal poll that we're asking people to do. We're going to aggregate it, and we're going to widely release a report about how broad the support is for Medicare for All. If this survey goes the way that we think it will, based on the numbers that are previously out there, we believe we're going to get a majority of people saying they think the system is broken, that they support Medicare for All. We have a great communications department at NNU, and we plan on using that to really push this message out and get some broad media attention. And we hope that once we do that, we will get the attention of Democratic politicians. As well, and one additional thing I'll just mention is that if we gather enough data in specific geographies, so for example, in Florida, we may also be able to release more localized reports to local and state media about the level of support within that area. So the timeline for the program is that we are kicking off all of this canvassing with a big weekend of action that's coming up pretty soon now, April 6th and 7th. It's not too late to sign up to host a canvas during the weekend of action. We're really hoping to like kick off the whole program with a bang, lots of canvases around the country. So at the end of my presentation, I'm going to share a link to sign up if you want to host a canvas with us. And you have, I think the deadline for submitting a canvas for the weekend of action is this Friday. So if you really wanted to just jump right in and help host a canvas during that weekend of action, you still can. But if that is a little too soon for you, we're going to be continuing this canvas program all the way through probably about mid-July. At that point, we hope to kind of wrap up the data collection, aggregate the results, and then in August, during the August recess, we will be releasing that report. So you could host a canvas anytime between now and the middle of July, whatever works best for you. And then also, just as a little sneak peek, we may be asking you to help spread the word about that report when we do release it in August. So stay tuned for more details on that. All right, so we really hope that you would like to canvas with us. You are the experts on your local area. You know where the best locations are. You know who would maybe want to join you for a canvas. You know when the farmers markets are. You know when it's too hot out. You know when there's a hurricane coming, all those good stuff. So if you would be willing to host a Medicare for All issue-based canvas in your area, all you would need to do is let us know when and where you want to do it. Then we put your event on our national action map and we help recruit for it. And then we give you all the materials, support, and training that you need. And we also we hosted a couple of training calls for how to host a canvas. Those have already happened, but we do have a recording. If you would like to see that, we can give that to you. All right, that is pretty much it. I'm going to put a couple of links in the chat for what I'm about to show on the slide, but your best next steps, if you would like to get involved with us, if you would like to help work on the Patients Over Profits Pledge and get politicians within your local area to sign the pledge, we have that action call coming up next Wednesday at 8 p.m. Eastern. And if you would like to host a canvas with us, either as part of the weekend of action in April or anytime over the next few months, you can sign up to host a canvas using that link. And again, I'm going to put these in the chat, so don't feel like you need the screenshot or anything like that. But that is all I have to say. I will stop my screen share and see if there are any questions that anybody has.